Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, nurses, and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager, and I'm your host. Today, we are going to talk about a term that I've been using a little bit more the last few months. I mentioned it in an episode not too long ago. It was some key takeaways from the PLMI conference that I attended in California in October. And Dr. Jeffrey Bland, who you are probably familiar with if you've been around functional healthcare for very long, he is the founder or grandfather now, they say, of functional medicine. And he brought up this term disruptor during the PLMI conference. And so I mentioned it a little bit in that particular episode, and I wanted to talk about it a little bit more. I've been talking to students about it in our meetings recently and just the idea. And I thought it would be good for us to explore it a little bit more in an episode of its own. The way that it came up during that conference was Dr. Bland and Dr. Mark Hyman were on stage kind of doing an open discussion. And Dr. Bland brought up that, well, basically he said, everybody in this room is a disruptor, and that we in some way are going against the grain in healthcare, and just acknowledging that and what that means for our future patients, what it means for our own practice, what it means for our reputation. And he was talking about how, Dr. Hyman has gone against the grain in many times in his career and how that has led to his role in the functional healthcare space. And then he was also bringing up how other speakers at the conference were disruptors in their field. And in particular, Dr. Dale Bredesen, it has been an issue for him in his career that he has not always had the level of respect that he deserves. I think we pretty much all could agree on that in the functional space, that in his field, he is often, particularly over time, not given credit for the value of the work that he's done. And now, even though the field and like brain health overall, like that whole approach to healthcare is evolving, he's still kind of being left out of that conversation. There was an example, I want to make sure I remember this right. I think I talked about it in that episode, but I think it was a JAMA article that was on specifically his work and the field. But even though it had like pages and pages, Dr. Bland said 30 pages of references, 0 of them were from Dr. Bredesen's work, even though this is what he does, as his work. And just that, I think a lot of us in this area of nursing, we really care deeply about, especially if you have a niche. I think a lot of my students will have a niche in like a really specific area of functional nursing. And to care that much about something and become an expert in it can be really fulfilling, but it also often has been maybe isolating a little bit. I think that in my experience, stepping away from allopathic healthcare and into the functional space, I experienced that where I felt like maybe I was respected more in my community before stepping away from allopathic medicine. And I know that has been the experience for many of my students that I've had this conversation with. So I wanted to talk a little bit about what disruptor really means, that it isn't just, if we talk about it from a larger scope, if we look at it more broadly than just functional nursing, it's not just like it's like rebellion for rebellion's sake or like going against the grain, or being a disruptor isn't about causing trouble. It's more, I think, about questioning outdated models that are no longer, in our case, serving our patients, no longer serving us as nurses. I think a lot of nurses come to functional nursing because they aren't feeling aligned with the healthcare system. And so it really is about shifting into a place where we do feel more aligned, going from like task-based care to more about looking for the why for your patients and offering something that you feel really good about in your practice. But then, I talk all the time with students about the conversations they're having with their peers, the conversations they're having with their families, their friends, their patients. And it really is like you're introducing a new way of thinking. And when we're learning it, it's kind of hard to wrap our head around. So it's, I think, a challenge for people to understand where we're coming from and why we're changing our messaging, maybe even. I definitely felt that way in primary care when I was like learning functional medicine and trying to weave it into my practice. And then also recognizing that maybe somebody coming back for a refill of a medication, I might have a new approach to what I had shared with them the last time they had seen me. And so that might have felt a little bit conflicting even in those early days for me. It isn't just about offering new services or like being a disruptor or becoming a functional nurse isn't about everybody going and opening their new practice and like defining what they offer in a way that's completely different than what they were doing in the past. A lot of this is about having different conversations with people. And that, of course, means our patients. It does mean our friends and family, but it changes the conversations that we have with our peers. And that can really impact I feel like, our reputation. I've definitely heard that from other nurses. We talk a lot in meetings about like, what do you want to call yourself and what are you comfortable with in your community? A lot of functional nurses will choose to use the term holistic nurse just because it feels safer for them. And they don't feel like they'll be judged as much with the changes they're making to their practice. For some nurses, it's the opposite, where they want to lean into the functional language because that's what people are seeking in their area. So there's definitely not like a right answer to this or how it's perceived. I have students in lots of different countries and in all the different United States, and it is received differently in different areas. And so being a disruptor in functional nursing or in healthcare at large is really on a spectrum, I think, as well. I think nurses are uniquely positioned to be disruptors because we are typically having the most conversations with patients and their families, our own families, our friends, talking to providing education for our patients. We are able to go into more depth and maybe raise some additional points in our conversations we have with our patients. We're obviously, as you know, I'm sure, considered the most trusted profession. And so we do have the opportunity to partner with patients and influence their health outcomes with the education that we provide. We're highly visible. We tend to spend more time with patients than other healthcare practitioners just based on the nature of our work. But I think that nursing historically has been like trained to kind of like follow orders, which I think is kind of a fun notion that, when I talk to nurses about scope of practice, and, I've had now over 1,000 nurses research their scope of practice and nurse practitioners and come back and talk to me about what they found. And I think the mentality that we follow orders or that nurses are there to comply or follow orders rather than challenge the status quo is ingrained in us. But when we research our scope, we find that it really isn't the case whatsoever. It's interesting how it's more of a mentality than actually like a legal consideration. One assignment that I've had students do in past programs is like find a way to become an advocate, write a letter to a legislator, find a way to advocate in a corporate healthcare system or their community, in a school setting, like whatever it might be for them that would be meaningful to try to help make change. And that in itself can be a disruptor, just trying to change the way things are done today and improve outcomes for our patients. I know for me personally, and I think just the nature of functional nurses at large is like, maybe this is like in our DNA or something, to want to question why we do things and to question how we could do them better and if we could offer something better for our patients. For a lot of my students, that leads to entrepreneurship. They really want to offer something different than in the setting that they've been in the past. So maybe they're creating services that are really different than the traditional model that they functioned in, or they realize that they can offer nursing services without being a medication passer or an orders follower, and rather to step fully into their role as a nurse. Often they will start consulting practices and work with patients. I consider that to be a disruptor because it is, if you're in a community where there's a lack of that and patients are coming into these quick 15-minute appointments, they're given prescription medications and sent on their way, follow up when refills are due, and you offer something where people can come to you and sit down and feel seen and partner with you and learn from you and change their healthcare trajectory. And it goes against that model of the prescription for every problem. I think that that in itself is being a disruptor. So I think that's an excellent example. I also think like shifting from the one-to-one model in itself is being a disruptor, creating community and space for patients. I have had a lot of students now and other nurses that I work alongside that have created either in their programs that they offer or in their community, for them to have, if they have a niche practice in particular, I think, and I've talked about this in recent episodes, creating communities in there, like having memberships for patients that are all working on the same cardiometabolic health. Like if a nurse has a continuous glucose monitor program and all of those patients are in a community together and can connect. Offering coaching group programs, focusing on prevention, all of those things, I think in a lot of communities that we are practicing in is disruptive to the current system and what is being offered patients. And, there's been a lot of talk about insurance, I think, in the news recently. And there's just also the idea that nurses offering something different. Healthcare has become extremely expensive. A lot of people have cut back to like the cheapest possible plan. And that means that a lot of things aren't covered or in network, and the insurance model isn't working right now. I don't know what's going to happen with that in the future, but it's just in the United States, it is not working for people. Even when people are covered, it's almost like things still tend to cost a lot, or later they find out that it wasn't covered. Plans are changing because of all the changes that have been made. And so a lot of nurses are offering things that kind of sidestep that, or patients are using their HSA or FSA accounts to pay nurses to work with them. I think all of that is disruptive. It's kind of like saying, this system isn't working and I'm not even going to participate in it anymore. I'm going to offer what feels more aligned with who I am. And I want to do an episode on that idea of like a lot of nurses feel burned out. And I really think that it's more about how coming to our profession and then figuring out what it really is, there's like a misalignment there. And I think functional nursing is the solution to that as well, for obvious reasons, I think. So beyond that, I think, there's a lot of, I could go down some rabbit holes as far as like being an entrepreneur. I think just that idea of the patient learning to become their own primary care provider, to kind of take charge of their own health and take ownership of the choices they make and the impact that that has on their health journey. All of that is disruptive, I think, as well. So that's one aspect. But I also wanted to talk about like, I touched on like the idea of a corporate healthcare system. I think that there's that whole other area that is really important to acknowledge is nurses working in those systems, just asking why instead of saying, okay, this is the way we've always done it. That is disruptive. Being the one to pose an open ended question during a staff meeting to kind of point out that maybe there's a different way to do things. That is disruptive. Proposing new like workflows or proposing to offer group visits in a corporate healthcare system, taking steps to prevent illness rather than just treating it. I feel like all of that's disruptive. Bringing the functional approach into corporate healthcare systems as much as possible. It doesn't have to be all super long one-on-one visits with patients. I think it's really important for this to be something that we weave throughout healthcare over time. And just that asking why or offering a little bit more education for people is so meaningful. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short on-demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the functional nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. A lot of my students will tell me like that they aren't allowed to or they don't feel comfortable providing that type of education in the setting that they work in. And we talk about like ways to navigate that. And obviously time is often an issue, and we talk about, using handouts, referring people to like somebody writer that they can find on ifm.org, where they can search for somebody in their area that's well trained. There are ways that we can refer people to get them the care they need, giving them resources like a book or a podcast, something somewhere where they can go learn more if you don't have time for it. But I think also like thinking through the art of sharing that information if you don't feel like it would be well received in that setting can be a challenge too. I don't think there's a right answer for how to do that. I think creating curiosity for patients can be helpful, just connecting them with some resources out in the community or digitally, like I mentioned, like a podcast or a book, so that they can kind of see that there's another way to look at things. That's a bit of an art as far as like being disruptive when you're concerned that it could get you in trouble at work. That's really important to acknowledge. We're not trying to get anybody losing employment over them trying to offer something different for their patients. A lot of my students on the other end of the spectrum have told me, like, yeah, I can't stop talking about this at work. And they have asked me to do lunch and learns or to start a whole new program that we are going to offer, connecting with the right people about it and saying it in the right way so it's well received. Sometimes, like I mentioned earlier, like using the word functional doesn't land very well. And so maybe you are just approaching it talking about nutrition or stress, sleep, mindfulness. Like, you kind of just talk about those concepts and maybe frame it as like a holistic nursing approach. And that can be received better. And then, yeah, I find that some of my students, it's really exciting that their employers are like, we want more of our staff to be aware of these things and to offer them. You never know. It really depends on the setting that you're in. I've had more and more students that are getting hired at functional and integrative practices where they can offer this in a place that feels more aligned. And then you feel a little bit less of a disruptor because you're in a community of other providers that are like minded. I think this is going to shift over time, like what that means. Just in the time that I've been teaching functional nursing, seeing it evolve and how much more people are receptive to it, it's been really fast, honestly. So I think there's hope for this to kind of be more mainstream and well received in the coming years. Like I mentioned, I think the language that we use to describe it is really important to reinforce that idea, to really think about how we're going to talk about it when we bring it up is important. We can talk about it as far as, using the term lifestyle can be helpful as well, to suggest maybe offering education programs around nutrition or stress, like framing it as just like nursing education can be really helpful as well. It can be hard to measure metrics of these, but I think that anytime that we have the opportunity to, for example, if you have patients that do a group setting for their visits or they participate in a group and they have a health diagnosis, tracking outcomes. If I want to think of like a specific example, this is a little off, but like if you had a group of people that were working on mindfulness for their anxiety and you used the GAD screening tool at all your visits with those patients, like the providers in your office, every time somebody comes back for a follow up for anxiety, they're getting this GAD screening done. And you can see that the people that have done that group program, their scores go down more than the people who did not participate in that group program. There are opportunities, like that's just an example, but like there are opportunities for us to think of how we can prove that our efforts are effective and track that so that we can advocate for more policy change and the way that care is delivered. So that's just like a side note example that I thought of. So I think the biggest challenge in this is the reputation topic. And I think for me, that has been, I think, when I worked in the hospital setting, I was a critical care float nurse for most of that time. I worked all over the hospital, but I mostly would go to like the ICU, step down units, cardiac care. And I felt like I was a resource. And often, if I was on shift, people would come to the other floor to ask me a question about their patient because they trusted me and maybe I had been their mentor in the past. I felt like I was very respected. I then went on to become a primary care provider in that same corporate healthcare system. And a lot of the people that I had been friendly with in the hospital, they'd passed on the word about me, would come to see me as a primary care provider. And that made me feel really proud that, they respected me. And I feel like when I stepped away from that and began teaching functional medicine and offering it in my own practice, I feel like that just kind of dropped off. It's kind of interesting now to think about because it was kind of a long time ago. I think that anytime that you're going to do something that isn't mainstream, people are going to look at it as like questionable, especially if that's still the role that they're working in that makes sense for them. And that's what they're around all day long. So I think that being a disruptor in healthcare can sometimes impact our relationships and our reputation. What I have noticed though over time is then as this has become more well received, that has kind of the pendulum has swung. And now it's like, oh, well, if you've established yourself in your community initially is that woo-woo nurse that's like offering something weird and maybe like they're questioning whether what you're doing is like credible or not. But like I tell nurses all the time, you'll just talk till you're blue in the face if you're trying to convince everybody in your community that what you offer has validity to it. But if you just focus on helping the patients that are ready to work with you and show up for care and you build your practice that way by serving the people that are ready. You don't need to convince everybody, and you're not going to convince everybody, and not everybody's even going to like you. It's like that Mel Robbins book that is really popular right now, Let Them. People are going to have opinions about what we do, and we can't let that get in the way of what we're trying to offer our patients and do for our own, hearts and why we're here as nurses. I want to acknowledge that that can really be a challenge for a lot of us. And the thing that can happen over time, though, is then functional medicine, functional nursing, this whole movement has really begun to gain traction. And then if you've established yourself as initially that woo-woo nurse in town, but now you're like the go-to person when other nurses in your community are like, oh, that actually makes a lot of sense. And I know somebody that practices that way. I'm going to reach out. So I think we should just frame it as like we're a little bit ahead of the schedule for everybody else coming to this movement. Several times I've had conversations over the years with nurses about the fact that we're like paving the way for everybody behind us. And so credibility can definitely increase over time. I think like staying true to yourself and your values. Sometimes just knowing who it's okay to have the conversations with and who not that's just the reality of being different than everybody else. And I think that happens to many of us. I think just remaining professional and working in our scope is really important, not worrying about what other people think and just staying true to ourselves, focusing on patient safety and being ethical. Sometimes it's that colleagues might feel threatened or they might be curious or they might be inspired by what we do. I think our patients and their outcomes can be our strongest advocates of the work that we do. And in particular, I talk a lot with nurse entrepreneurs about getting testimonials from patients and how to do that effectively and how to use them. And I think that that can build credibility over time as well. So that can be really helpful. We can be disruptors in other ways that aren't specifically working directly with patients. I touched on a little bit that being a disruptor might mean offering something in your own practice. It might mean appealing to your corporate healthcare system and trying to change something like the food in the hospital system. That comes up a lot. The food in the schools in your community. Those things I think are being disruptive in a good way. But it can also be like advocating for change. I'm going to the AANP Health Policy Conference again in February. So I've been thinking about this recently. So it could be literally like lobbying for change with the senators and Congress people that are in the United States, if that's the case for you, or in whatever country you're in, advocating for change. That's disruptive. I've said on several episodes recently, the American Medical Association and the American Hospital Association are the two big lobbying organizations for healthcare. I mean, just think about that for a minute, because the American Medical Association spends a ton of money lobbying to suppress us as a profession, which is a whole nother topic, but they're not doing a lot to improve patient outcomes or access or get people covered for health insurance and have like really basic needs met. That's my opinion. You can look at the work they do, but a lot of it's focused on us and kind of targeting us, which is really unfortunate. The American Hospital Association, they want to make money. They are not advocating for the patient's best interest whatsoever. So those are opinions, but so who is lobbying for the patients and who's lobbying for us? And I think that being a disruptor is like a really important aspect of this topic that I want to just acknowledge is that nobody else is going to show up on Capitol Hill in the United States, for example, and advocate for what's best for our patients the way that we can. And there isn't really anybody else doing it. And I think that like any role that you can play there is really important. The big thing that I've mentioned in a couple other episodes that is a take-home message for me after starting this process more is just learning that politicians don't know all of this stuff. They're making decisions based on who's in their ear. And if it's the AMA and the AHA, it's not in the patient's best interest. They just are not that worried about them. So it should be us, and offering to be somebody that could help create awareness for your congresspeople, for senators, and more on the local aspect as well. So in your communities, if there are politicians that you can help support, and just like a lot of my students will write a letter and just say, hey, this is a meaningful topic for me. Did you know XYZ? Here's a little bit of research around it. If you ever have any questions or have like policies come up, or I'd love to sit down and talk to you about this more. That's the only way they know how to vote and like to make informed choices is for somebody to give them accurate, useful information that has a positive agenda. So that's definitely an opportunity to be disruptive as well. We can also do it in, a couple simple ways like precepting and teaching the next generation of nurses behind us and helping them to take that same approach in their care where they're asking why and really leaning into being an educator and helping patients become their own primary care provider. I think all of that too is being disruptive in a good way. So I think this whole topic is just like more and more I've been thinking about the nurse's role in advocacy. If you haven't checked out on IFN's website, fxnursing.com, we now have a page called Impact. And a lot of that is about the roles that nurses can play in being disruptive. So if you haven't checked that out yet, I encourage you to. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.